perform hand hygiene and draw the curtain for privacy. Good afternoon, my name is Maureen. I'm a student nurse with Roseman University of Health Sciences. How are you doing today? Good. Good? Okay. Can I ask your first and last name, please?
Karen Gibson.
Karen Gibson? Okay, and what do you prefer to go by? Karen?
Karen.
Karen? Okay, and your date of birth, please?
2993.
2993? Okay, great. All right, is this comfortable for you? Would you like me to tilt the bed up a little bit?
Yeah, can you raise the bed?
Okay. Shh. All right, excellent. So I'm going to raise the bed up to a comfortable height so that we can talk together. And on a scale of 0 to 10, with 0 being no pain at all and 10 being the worst pain you've ever experienced, how much discomfort are you in right now?
0.
0? Okay, great, excellent. What we're going to do today is a head-to-toe physical assessment. So we're going to go through some different activities together. And if you have any questions or you want to stop at any time, please just let me know. Okay? All right. So do you know where you are today, Karen?
Roseman University Hospital.
Okay, great. And do you know what time it is?
Afternoon.
Afternoon. And do you know what day it is?
The 6th.
The 6th? Okay, great. So patient is alert and oriented times 3. The patient articulates well, is able to respond to my questions. She's able to hear, and she's lying comfortably in no distress, supine with her head tilted towards me. She appears to be well nourished and pink, and there are no foul odors present in the room. Okay, so first thing we're going to do is take a set of vitals. Okay, so we'll start with your temperature. So I'm just going to take your temperature and put this under your tongue. Okay, great. Okay, your temperature is 98.6, so within normal ranges. And now we're going to take your oxygen saturation rate. Okay. And your O2 saturation is 98% on room air. Okay, now we're going to take your radial pulse. Okay, so I listened to her radial pulse for 30 seconds, and then I multiplied it times 2. Her radial pulse is 60 beats per minute. The rhythm is even, and the force is 2+ or normal. And then for the remaining 30 seconds, I watched her respirations, which were 10 breaths per minute, unlabored, no use of accessory muscles. Okay, so now we're just going to check for your brachial pulse here. And then take your blood pressure. All right, great. Okay, so first I'm going to find a reference point where her radial artery is occluded. Okay, now we're going to take your blood pressure by auscultating the brachial artery. Okay, your blood pressure is 100/70. Alright. And now we're going to actually check your capillary refill here so I can see your fingers. Okay, great. Capillary refill returns in under 1 second, and we're going to check your skin turgor on your forearm and your sternum, and there's no tenting. The patient appears to be well hydrated. Okay, so now we're going to listen to some breath sounds here. Listen to your lungs. So when I put, you feel the stethoscope on your skin, if you could just take a deep breath in and out through your mouth for me. Okay, thank you. Okay. Right upper lobe. Left upper lobe. Right middle lobe. Left lower lobe. Left lower lobe. Right lower lobe. Right lower lobe. Left lower lobe. Okay, and those are your anterior lung sounds. Now we're going to listen to your posterior. If you could just sit up for me. Patient is able to sit up without assistance. Okay, left upper lobe. Right upper lobe. Left lower lobe. Right lower lobe. Okay, I hear clear vesicular sounds in all lobes of the lungs. And now we're going to listen to your heart, okay? So I'm going to listen to a few different spots on your chest. And when I get to your apical pulse, I'm going to stop and count your pulse for 60 seconds, just so you know. Okay? All right. So first, I'm going to listen at the second intercostal to the right of the sternum, the aortic area. And next I'm going to listen to the second intercostal left of the sternum, the pulmonic area. And then I'm going to listen to the fifth intercostal left of the sternum, tricuspid area. And then I'm going to auscultate your apical pulse at the fifth intercostal mitral area. And I'm going to count your apical pulse for 60 seconds. Okay, your apical pulse is 60 beats per minute, which is the same as your radial pulse, so there is no pulse deficit. A pulse deficit is defined as the difference between your apical pulse and your radial pulse, and I hear S1 and S2 in all areas of the heart. Okay, great. So now what we're going to do is take a look at your abdomen. So if you could just lie down here for me.